Thank you, Mr. President. I come to the floor today because we are now in the middle of November, and we know that we have open enrollment in our health care plans, and we have consumers trying to make choices, and we need to give them clarity that we can help drive down the costs. As somebody who worked very hard on the Affordable Care Act and one provision that was different than the exchanges, the basic health plan, I can tell you that this plan has been successful at making a market for consumers at the low end of the market above the Medicaid rate, but up to 200% of the Medicaid rate, and providing them with affordable insurance through something called the Basic Health Plan. It's in 4 states and soon to be in the District of Columbia. And if you think about it, an individual buying on the exchange would probably have to spend about $9,500 to get an equitable silver plan. But these individual states purchasing on behalf of bundles of their constituents are only paying $6,000 for that same plan on an annual basis. So what are we doing, Mr. President? We are basically making a market. I say it's like going to Costco. If you buy in bulk, you get a discount. If you allow these states to buy on behalf of a large pool of their constituents who can't make a market on their own, you obviously can get a discount. So I'm very interested in us continuing and saving federal dollars and delivering good health care on something called the Basic Health Plan. So I'm not surprised that yesterday or the last few days, the world in D.C. anyway and around the country has erupted into this debate about how do we make health care more affordable. That is exactly right. And how do we make sure that big insurance doesn't just capitalize? Now all of a sudden, both sides of the aisle are talking about the insurance companies making the money, and how do we drive down the cost? So I appreciate that, and I welcome the chance to talk to any of my colleagues. In fact, I saw that the Wall Street Journal had an column today basically saying, quote, Republicans pitch alert alternative to the ACA to end the government shutdown. I was glad to see that. I thought that was a great alternative. I don't know how much it was just discussed at your lunch or how many of these ideas of making health care more affordable were discussed, but I definitely think this particular idea by my colleague, Senator Cassidy, has merit, only because I think the senator on the Finance Committee, along with myself and chairman of the Health Committee, has tried to look at ways to make health care more affordable, and it deserves some fair consideration. This idea is really something called a health reimbursement account. And since 2008, health reimbursement accounts have been a critical component of one state's Medicaid program, the Healthy Indiana Plan in the state of Indiana. Today, over 800,000 Indiana Medicaid enrollees automatically have access to these accounts and are using them to lower their medical expenses. The state of Indiana pays for the first $2,500 in health care costs, which covers a large portion of their insurance plan's out-of-pocket expenses, but the enrollees make monthly contributions depending on their costs to upgrade their health care coverage to more generously include things like vision and dental benefits. And one of the biggest benefits of the Indiana Health Reimbursement Account is that the program encourages good financial management and the use of preventative care like annual checkups. So currently, if an enrollee spends less than the $2,500 in medical costs and uses preventative care, they can roll over their remaining account to the next year to lower their monthly medical expenses. This has been a proven path to promoting responsible and measured healthcare spending. It also encourages, as I mentioned, the use of preventative care, and we all know we need to drive down cost in the long run. What happens when we don't have good health insurance, and as we see November and December coming without a real plan for millions of Americans to buy affordable insurance, we are just going to drive up the cost of uncompensated care. The Affordable Care Act has lowered the amount of uncompensated care and helped us lower the cost of insurance overall, but we need to keep going and we need to do more. So I think that these health reimbursement accounts proposed by my colleague, Senator Cassidy, I hope that this article in the Wall Street Journal is serious, that Republicans are interested in floating this idea, and that the Affordable Care Act marketplace coverage has a variety of ways in which we all can take place in a conversation to drive down the cost of care. The health reimbursement accounts already in place in Indiana and here in our federal employee health and benefit program, and also in the DC health exchange as well. So it's not as if there's only one place that is doing this. In those instances, it's a voluntary program, so people can voluntarily comply, voluntarily decide to take the program up and participate in, and as I said, get involved in better healthcare decision and better timeliness of these decisions. So I have no idea, Mr. President, what's going to happen here today, but I know this: there is enough time to talk about good ways to lower the cost of health care, particularly for this population that it has to make benefit decisions right now, lower these costs, implement this, and get our government back open. I hope that people will give serious consideration to what my colleague, Senator Cassidy, and others have talked about in this very important area of driving down the cost of care. I thank the President, and I yield the floor.